You know that feeling when you have an ache or a pain and it's just a total mystery? That nagging strain that an x-ray just can't see? Well, today we are going to pull back the curtain on a really fascinating logical system that was designed to solve that exact problem. It's a method that turns figuring out soft tissue injuries from guesswork into a science. So, here's our game plan. We're going to start with the mystery itself, this confusing thing called referred pain. Then, we'll meet the brains behind the operation, the doctor who created this logical toolkit. We'll even put that toolkit to the test on a really common injury, and then we'll wrap up by seeing why this whole approach is such a big deal. All right, first things first, let's talk about one of the weirdest and most confusing things about pain, the fact that where you feel it isn't always where the problem is. I'm sure you've experienced this, right? Maybe you have an issue in your lower back, but what you actually feel is a sharp pain zinging down your leg. This whole phenomenon is a massive piece of the puzzle we're trying to solve. So there's a name for this. It's called referred pain. And it all comes down to our body's wiring. Think of it like a bunch of nerve highways, all merging together on their way to the brain. Sometimes the brain gets a signal from a deep tissue, like a muscle. But because that signal is on a shared highway, the brain gets its wires crossed and thinks the problem is coming from somewhere else entirely. So, how in the world do you solve a puzzle like that? Well, this brings us to Dr. James Cyriax. He was a physician who looked at this messy problem and thought, there has to be a better, more logical way to find the real source of these pains. And really, his entire philosophy comes down to this single idea. It sounds so simple, right? But it's actually incredibly profound. If you're just treating the spot that hurts, the referred pain, you're not going to get very far. You have to find the origin. You can really think of him as a medical detective. He knew that x-rays are fantastic for looking at bones, but they're basically useless for seeing what's wrong with our muscles, our tendons, or our ligaments. So he built a system from the ground up to systematically hunt down the exact soft tissue that was causing all the trouble. So what was this revolutionary method? What's inside this diagnostic toolkit that lets you pinpoint the exact culprit? Let's open it up. Okay, this is the first really brilliant move in his method. Cyriax said, let's simplify everything. He divided all the soft tissues into just two main groups. You've got your inert structures, that's the passive stuff, like ligaments that just hold you together, kind of like the body's frame and cables. And then you have the contractile structures, that's the muscles and tendons, the parts that actually contract and create movement. They're the body's engine. Now here's where it gets really clever. Because these two types of tissues do totally different jobs, you can actually test them separately. To check out the inert, or passive structures, the therapist moves the joint for you. You just relax. But to test the contractile, or active structures, you push or pull against the therapist. See what's happening? It's a way to put stress on one system while keeping the other one quiet. And this whole system has a name. It's called diagnosis by selective tension. You're selectively applying tension to very specific tissues and then just listening to the body's response. By figuring out exactly which movements hurt, which ones don't, and which ones feel weak, a good clinician can just cross possibilities off the list until they've zeroed in on the real problem. Okay, I know this might sound a little bit theoretical, so let's make it real. We're going to grab this toolkit and use it to solve a classic case that you've probably heard of, tennis elbow. All right, imagine we have a patient. Here are the clues from our examination. First, the therapist passively moves the patient's elbow through its range of motion. Nothing. No pain. Okay, clue number one. The inert structures are probably fine. Next, the patient bends their elbow against resistance. It feels strong, and again, no pain. Okay, so the bicep muscle is in the clear. But then, the therapist asks them to extend their wrist back against resistance, and boom, it's strong, but it's painful. That is our smoking gun. So the million-dollar question is, what does that specific combination, strong and painful, actually tell us? This isn't just a random finding. In the Cyriax method, this points to something very, very specific. And this right here is basically the detective's decoder ring. If a resisted test is strong and painless, great, everything's normal. If it's weak and painless, that's actually more concerning. It could be a full rupture or a nerve problem. Weak and painful, that points to a more severe injury, like a partial tear. And our finding, strong and painful, that tells us we're looking at a minor lesion, like a simple muscle strain or a tendinopathy. And just like that, the whole puzzle clicks into place. That strong and painful result during resisted wrist extension points directly to a minor lesion in the contractile tissue that does that job, the wrist extensor tendon. The mystery is solved. We have a clear, precise diagnosis for tennis elbow. And we got there through logic, not guesswork.
So we have our diagnosis, and that's great. But why does being this specific actually matter so much? Well, it's because a precise diagnosis is the only way to get to a precise and truly effective treatment.
It brings us right back to that core philosophy. Step 1, use the system to find the exact source. Step 2, apply a treatment that can actually reach that source. And step 3, the end goal is always the same: get back to full, pain-free function.
For instance, once you know for sure that the problem is a tendinopathy in that specific spot on the elbow, you don't just throw general treatments at it. You can use a very targeted technique, like deep transverse friction massage, right on the exact spot to help stimulate healing. The treatment perfectly matches the diagnosis.
And that really leaves us with a final thought to chew on. What this method really teaches us is that pain, even the complicated kind that you can't see on a scan, doesn't have to be a mystery. It's a puzzle. And if you have the right logical framework, it's a puzzle that absolutely has a solution.